Hello everyone, welcome back to my channel. Myself Monica, and after a long time I'm back with a new video which is commonly used drugs in ophthalmology with mnemonics. So I have made some few mnemonics so that it will be helpful for you to remember few points. So whatever I will be telling here, it's according to my syllabus, college syllabus. So whatever drugs were shown in my college, I have put it here. And I hope I have also I will also say about these questions that were asked to us in our examination. I hope that you will get some benefit from this video. So now let's get started. The first one is flurbiprofen sodium ophthalmic solution. So by the name also, I'm sure you must have guessed in which category this medicines belongs to. So this is ketorolac tromethamine ophthalmic solution, 0.4 percentage. So these were the two that were shown in my college. So I have put here, I have taken these pictures and have kept the outer cover of that medicine here. And the questions that you will be asked, like what are these drugs, in which group they belong to, so you have to say these are NSAIDs. Obviously flurbiprofen, ibuprofen, quite similar, so you totally can identify it. And indications, I have Yasuda. Do you know Yasuda? Like this is the name, okay, especially in Nepal and India, this Yasuda name is very popular. So I have replaced Y with E and I have made it Isuda as a mnemonic. So indication: episcleritis, scleritis, uveitis, preoperatively to maintain dilation of pupil, especially flurbiprofen it is used, and allergic conjunctivitis. So these are the 4 uses of the NSAID. So you will be asked indications or side effects. So in side effects, one very common side effect we know, that is systemic side effect: bronchospasm, headache, nausea, vomiting. And in the eye, you can always write burning sensation in every drug, or stinging sensation, or discomfort. These are very like common things in case of ophthalmology. Conjunctival hyperemia, pupil dilation, mydriasis, okay, and sensitivity to the light. So the next thing that you could be asked is the classification or the group of these drugs. So I have given this classification chart over here, you can go over this. So this video as a whole will be like a note for you people for ophthalmology practicals in case of its drugs. So you can take it as a note only. And here I have mentioned some percentage of the solution, NSAID solution, that we will be using. Most of them, they are 0.1 percentage, if not 0.3, and then 0.09. so it is given over here. Now let's go to the next drug, corticosteroids. So prednisolone acetate ophthalmic solution, okay, this is given like this. And by the name only you can identify, obviously. So if it's asked about in mechanism of action, then we can say anti-inflammatory activity. So inhibition of chemotaxis, most common effect, and production of annexins, lipocortin, that are responsible for indirect inhibition of phospholipase A2 that blocks the release of arachidonic acid, okay, and immunosuppression. So we know, obviously we all know what are the functions of this glucocorticoid. So that only you have to write, but just making match with this ophthalmic uses. So the ocular indications is, I have made a mnemonic as a uveitis, scleritis, allergic conjunctivitis, and again from A, allergic keratitis, and after intraocular surgery. So U as A, okay, but I have just written one A. So you can even write 2A, like USA 3 or whatever it is. So uveitis, scleritis, allergic conjunctivitis, allergic keratitis, and after intraocular surgery. And systemic, it is like posterior uveitis, papillitis, scleritis, corneal graft rejections, anterior ischemic optic neuropathy. So, and the side effects are first important from the corticosteroids drugs. So you have to always mention that these topical steroids, especially glaucoma, they are contraindicated, or the side effects are in glaucoma, cataract, dry eye, ptosis, and activation of infection given in herpetic, fungal, and bacterial keratitis. So these are the most common side effect of the this steroid drug, okay, prednisolone. So you have one, I'm not going in depth of each and everything. This is just like a note that I'm sharing with you all. So just the questions that you will be asked and the important highlight points. So next one is Tear Plus lubricating eye drops or Tear Plus. So we all must have used it sometimes, especially during the cases of dry eye. So it must be a very familiar drug with you all. So it contains a viscosity agents like methyl cellulose 1%, hydroxymethylcellulose, or polyvinyl alcohol. So you might be asked like what are the is contents of this Tear Plus important one. So you have to mention like methyl cellulose, hydroxymethyl cellulose, or polyvinyl. Okay, these are the main ingredients because they helps in enhancing viscosity and they helps to promote tear film stability. So you might be asked question like this. And obviously uses like foreign body, dry eye, ulcer, chemical injury, inflammation. So these are the uses of the Tear Plus. And some side effects like discomfort, as I said, you can write discomfort in almost all drugs of that are used topically in the eyes. So that's what are important from here. So the next drugs will like ciprofloxacin. Obviously by looking at these names I'm 100% sure that you must have guessed it. So these are antibiotics. So these were the drugs that were shown to us: ocupol, moxifloxacin, ofloxacin, ciprofloxacin. So from here the things that you have to remember is the percentage, okay, and the uses. Obviously antibiotic means they will be used for bacterial infections, so bacterial conjunctivitis, bacterial corneal ulcer, chemical and mechanical injury, and trachoma. BBC, you can remember it as BBC also. And antibiotics, so there is B in antibiotic, so therefore bacterial conjunctivitis, bacterial corneal ulcer, chemical and mechanical, and trachoma. And irritation, dry eye are the side effects, temporary blurred vision, congestions, allergy. So these are the side effects. So one more thing that you have to remember is their mechanism of actions. Okay, so I have mentioned the mechanism of action of only those drugs like fluoroquinolones and chloramphenicol, and there are other important antibiotics like penicillin derived cephalosporins, aminoglycosides, tetracyclines, macrolides. So you have to remember their mechanism of actions too. So for now I have mentioned of fluoroquinolones and chloramphenicol. Fluoroquinolones inhibits the enzyme DNA kinase, primarily active in gram-negative bacteria. So they have first generation and second generation. First generation ciprofloxacin and ofloxacin, second generation levofloxacin, moxifloxacin, and lomifloxacin. And chloramphenicol, they inhibits the bacterial protein synthesis. This is enough, okay, for ophthalmologist further in third years. And now this I have already explained. Now let's go to the other drug, that is antifungal, natamycin ophthalmic solution 5%. Nothing much you will be asked. You will be asked just indication and side effect. Indication obviously antifungal, so fungal corneal ulcer, blepharitis, conjunctivitis, keratitis. And side effects: teary, watering eyes, feeling like something is in your eye, redness and swelling, and eye pain. Okay, eye pain is the side effect. So these you can see in the antifungal drugs. So these are all about antifungal. Now let's move on to the next one. So these are Mydriatics and cycloplegics. So what are Mydriatics? Drugs that causes increase in diameter of pupil or dilation are called Mydriatics. D for dilation, D for dilation, whereas drugs that causes both pupil dilation as well as ciliary muscle paralysis are known as cycloplegic. Okay, ciliary muscle, so C, ciliary muscle paralysis, so cycloplegics. So you will be given tropicamide and then you will be given atropine. And the one thing that you have to remember is their onset and their recovery. So I was asked in my viva what is the onset for this drug. So atropine and tropicamide I was asked. So 18 hours after the last instillation, and tropicamide is 20 minutes after the second drop. Tropicamide is usually for 4 hours and atropine for 10 to 14 days. It takes a recovery time, and other things you can just go over here. I will not go into detail. I am just here to guide you what are the things that are important in your exam. So this is the chart that we have to learn. and these are antimuscarinic drugs, and I have written some description regarding it. So there is one very important point. So belladonna, alkaloids and romance. Belladonna means beautiful woman in Italian. Women in the ancient Roman Empire used eye drops derived from belladonna plant in order to dilate the pupils for cosmetic effects. So back then, a long time ago also, people used something like this to showcase such effect. And the presence of dilated pupils, bedroom eyes, can be interpreted as a sign of being sexually attractive or sexually attracted to another. Dim candlelight also causes pupil dilation, which is why these conditions are considered romantic. So I have given your indications and adverse effect, okay, as a whole combining, but in another page you can just find a more sorted indications as well as contraindications. So Mydriatics example are tropicamide, adrenaline, phenylepinephrine, whereas cycloplegics are atropine and cyclopentolate. Mydriatics, their indications are like pupil dilation, refractions before intraocular surgery, whereas cycloplegic, they are used also in inflammation of uvea, malignant glaucoma. So cycloplegic, these drugs are especially used in hypermetropic eyes. So why they are used in refraction is because of the effect of accommodation in the hypermetropic eyes. Okay, so what happens in hyperopic eyes? So whenever we go for checkup, so automatically eye accommodate both in the distance as well as near regions. Okay, so that a sharp image can be formed. In such cases, refraction in such cases gives us misinterpretations, and we may give under corrections in hypermetropic eyes because of accommodation. So to remove that accommodation, we give cycloplegic or Mydriatics, so that they will paralyze the ciliary muscles and then there will not be accommodation. Okay, so that's the reason, and all the points are here. So contraindications: hypersensitive, narrow angle glaucoma, cataract patients and elderly patients. And contraindications like closed angle glaucoma, contact lens, infants and pregnants. Okay, so what happens is angle closure glaucoma is glaucoma which is associated with physically obstructed anterior chamber angle, which may be chronic or rarely acute. So what happens is in narrow angles, the distance between the iris and the pupil is already small. Okay, that's why when the iris dilate, okay, it forces the iris. Okay, when the pupil dilate, it also pushes the iris, which results in the closure of that angle and prevents the aqueous from passing between the lens and iris through the pupil and into the anterior chamber, and this is known as pupillary block. So because of this reason, so it is not used in narrow angle glaucoma where the angle is small. So the angle, since the angle will close and there is the restrictions of the blast of the aqueous humor, so it is not used. Okay, and in cycloplegic also, in closed angle glaucoma also, cycloplegics, okay, they might, with the help of pupillary dilation, it might cause congestion in the anterior chamber, and that may also lead into the rise in intraocular pressure, so they are contraindicated. And other things are like contact lens, infants and pregnant, so similar to the Mydriatics. So those are the things that you should know. And another thing that is like an extra point is that the Mydriatics and cycloplegics, you will always find them with the red cap, whereas Mydriatics, okay, which helps in contraction, like the opposite action of their atropine and the tropicamide. So this pilocarpine just has the opposite action, so it has the green cap, so that it becomes easy to differentiate both. So one has this red cap and the opposite one has the green cap. Mydriatics, they have the green cap. That's just for an extra point that you should remember. The next things are timolol, so the glaucoma drug. So the indications are like glaucoma. So on glaucoma we can see increased intraocular pressure or ocular hypertension. So similar, it's quite easier to understand. All of these are related. Side effects like burning or stinging, dry-eyed, red eyelids, again, which I've already explained, and contraindicated for asthma and COPD patients and in the severe heart failure. So these are the things that you have to remember, nothing much, just the indications and side effects. And the next thing, so you will be studying this more when we will be talking about the glaucoma separately. for now, just from the exam point of view, let's study it. And the topical drugs for glaucoma. So classification is very important, so you have to remember this classification. At least when they ask you, you should be able to say few drugs name, or if you can, then tell them properly the proper classification for the glaucoma. And the next one, the drug we will be studying is the analgesic, that is lignocaine hydrochloride topical solution, 4% topical solution. Also indication is okay, usually for the lacerated wound injury, to remove foreign body. So adverse effects are quite similar to others, so usually it shows an effect in 8 to 10 minutes. And that's all about the lignocaine, nothing much you will be asked about from here. The next last one will be the Ocupol. So methanol and camphor, they give the cooling effect. Phenylephrine and naphthalene are decongestants. So this Ocupol consists of phenylephrine hydrochloride, naphthalene hydrochloride, methanol and camphor. So I have just given each indications. So methanol and camphor for cooling effect, phenylephrine and naphthalene are decongestants by work by narrowing of blood vessels to the eyes to relieve the inflammations. So usually used in allergic eye disease, or sometimes people, this after having too much of alcohol, and whenever they have hangover, so they have this redness on the eyes. So to remove that, okay, the students sometimes they use this drug. So this is all about the commonly used drugs in ophthalmology. So you can just make some notes with every topic that I have given here, and please go with the extra other topics also if you have taught about it or if you know about it. So I hope that this video will help you in small or big way in your exam and in your daily life. Saying so, please do like, share and subscribe to my channel. Thank you.